Hi there, from Chicago MidWinter 2014. My name is Meyers with American Eagle Instruments. I wanted to share with you some information about our Sharpen free XP technology instruments and some of the things we've learned along the way about hygienists who love our instruments but who aren't realizing some of the hand health and ergonomic benefits of these instruments. And I have with me Karen Siebert, who is a hygiene instructor who is going to help explain some of the great benefits of not only utilizing XP technology instruments because you don't have to sharpen them at all for the life of the instrument, but also because you don't have to work as hard. Karen, what have you learned since you began using XP technology instruments a couple of years ago?
Well, one of the things I've learned is that you can save your hands because you use such a light grasp when you're shaving the calculus away that you don't have to worry about getting carpal tunnel syndrome or feeling that strain at the end of the day in your hand. You're able to hold it at such a light touch and still be effective because of the sharpness of the instrument.
And the reason for that is because stainless steel instruments, interestingly enough, are about as hard as tenacious calculus. So the way that hygienists are taught in school to remove calculus is to pop it off, to find that ledge, right? To get underneath there and pop it off. XP, the titanium nitride that makes an XP technology instrument is significantly harder than steel, so we coach our clinicians to slightly modify their scaling technique and shave through calculus. Lighten up your death grip and shave through the calculus. But what about the risk of burnishing? Because when we tell that to hygienists, oftentimes that's their first question.
Exactly. Because of that hardness being so much harder than the calculus itself, you don't risk burnishing. It's going to come out so smoothly that you will get to the tooth surface.
Karen, in conversations that I have with hygienists, this slight scaling, this slight modification and scaling technique isn't necessarily intuitive for all dental hygienists.
This is true, especially those of us who've been practicing a while. It is, sometimes I even find myself putting a little too much pressure on because that is so ingrained in us. But I liken it to using a Cavitron. You're using a light touch like you do, and you work from the outside of the calculus to the inside of the calculus, just like we do with a magnetostrictive Cavitron situation. And that seems to help us all understand what we're aiming for.
Right, it's this light, exploratory scaling stroke is all that's needed to get the job done with XP.
Yeah, it is, and then you end up training yourself, and suddenly you're just constantly doing that.
You know, this is totally impromptu. We have some, hey ladies, just out of curiosity, are you XP technology instrument users?
Yes.
Really?
Yes.
Really? Oh, yes. Okay, I'm just gonna come over. This is Sherry Bohr. I'm interrupting probably taking an order, but I want to ask Aaron and Jennifer, tell us how you use XP instruments. I'm curious to know what you love about them.
Well, I love that you don't have to sharpen them. Love it.
That's great. I love that it saves time in the operatory and it's more comfortable for the patients.
Those are all good.
Good questions,
yeah.
But what do we, okay, so let me ask you this. Do you use them differently than, say, the stainless steel instruments that you were trained on?
No, I don't.
In fact, how do you go ahead and remove calculus with an XP instrument?
I go to the bottom of the ledge of calculus and pop it off.
Okay.
You see what I'm talking about here?
And that is what we're taught to do with the stainless steel instrument because the calculus and the stainless steel are close in hardness on the hardness scale. With an XP, because it's so much sharper and harder, we're able to use it differently. And can I just show you a modified technique for this?
Please,
okay.
Please.
One of the great things about modifying this technique is that you're going to save your wrists and hands because you just need a very light grasp. So this is a blackjack. I bet you love this instrument, right?
Yes, one of my favorites, definitely.
You still use all the principles that we are taught. You use the fulcrum, a strong fulcrum. You set your patient up correctly. And you want to still follow the roll principle and everything, but you're using such a light grasp as you're coming around a tooth that you should go ahead and try and take that out of my hand while I'm scaling.
Wow, it's really light.
I am not grasping that very hard at all, and that's part of the the beauty of this is that we can save our wrists and hands over time and practice much longer, what we love.
Wow.
The ability to not have to sharpen your instruments is great. You love that, yes?
Yes.
But
Yes.
if you lighten up your death grip, you should find that at the end of a full clinical day, you're not as fatigued. And if you're using the instruments correctly, you should find that they last longer.
Yes,
Wow.
they will.
Man.
Thanks, Aaron. Thanks, Jennifer.
Thanks,
You're
girls.
perfect. That's what we're trying to get our audience to understand. The Sharpen free aspect of these instruments is great, but the hand health and ergo benefits is something that we really get excited about. Thanks so much. That was incredible.
It was. It was really incredible. It's exactly what we were talking about. The ergonomic benefits just aren't known yet, and we
Right.
need to get that out there.
Exactly. The XP, everybody knows that you don't sharpen our instruments, but the hand health benefits are
Yeah.
unrealized by so many people.
Exactly.
And that's what excites me, I think, probably more than anything.
Yeah.
Yeah. So if you want to learn more about our instruments that we're so proud of, come find us online at www.am-eagle.com. Customer service can be reached by calling 1-800-551-5172. Karen, thanks
Thank
for being
you,
our
Louis.
expert.
It was
Appreciate
really
all that
fun.
you do.
Thanks.
Folks, from Chicago MidWinter 2014, so long. We'll see you next year.